Welcome to Research Reflections, where we explore science and health research in a gentle, relaxing way. In each episode, I share interesting research explained simply so you can stay informed and curious without ever feeling overwhelmed. So if you'd like to learn something new and perhaps feel a little calmer along the way, you're in the right place. Let's get started. Today, I'd like to share a study that focuses on poor sleep as we age and the impact that exercise might have on improving it and heart rate variability. Sleep troubles are incredibly common, especially as we get older. Yet despite all the pills, apps, and gadgets we see advertised, surprisingly few people ever seek real help for their sleep problems. In fact, less than 15% of people with chronic insomnia ever receive treatment, or even talk to their doctor about it. Maybe because it feels like a small problem, or perhaps because the nights feel endless and lonely, and we think we just have to live with it. But sleep isn't small. A lack of good sleep can chip away at our mental and physical health, our energy, our mood, and our quality of life. That's why I want to share this particular study today. It's called Effects of Exercise Training on Sleep Quality and Heart Rate Variability in Middle-Aged and Older Adults with Poor Sleep Quality. It was published in the Journal of Clinical Sleep Medicine in 2020, and you can find a link to it in the description below. The researchers wanted to explore something quite simple, yet powerful. Could moderate exercise help middle-aged and older adults sleep better, and even improve their heart health at the same time? To test this question, researchers gathered 40 adults in Taipei, Taiwan, all over the age of 40 with an average age of 62. Among them were 33 women and 7 men. Each person had one thing in common. They were struggling with poor sleep quality. These weren't just people having the occasional restless night. On average, they were sleeping less than 5 hours a night, feeling drained and exhausted during the day. The researchers designed what's called an assessor-blinded parallel group randomized control trial. That means participants were randomly assigned to one of two groups, and importantly, the people measuring the results didn't know who was in which group, which helps keep the findings unbiased. Half the participants joined a hospital-based exercise program. This involved 40 minutes of treadmill walking, supervised to maintain a moderate intensity, followed by 10 minutes of stretching. They did this 3 times a week for a total of 12 weeks. The other half attended a 1-hour educational session on sleep hygiene. We don't know exactly what was covered, but it might have included topics like keeping a regular sleep schedule, avoiding caffeine late at night, and creating a comfortable sleep environment. After that, they simply continued their usual routines. Not just anyone could participate in this study. The researchers carefully excluded people who had health conditions that would make exercise risky, were diagnosed with sleep or psychiatric disorders, were taking medications known to affect the nervous system, or were already regularly exercising. They also asked everyone not to change their diet, medications, or activity levels during the study, except for the prescribed exercise for those in the intervention group. To measure the impact of exercise, the researchers used several tools. First, there was the Pittsburgh Sleep Quality Index, a questionnaire asking about things like how long does it take to fall asleep, how restful sleep feels, whether you wake up during the night. It's a subjective measure based on how people feel. They also wanted objective data, so they used a small wearable device worn on the wrist to track when people fell asleep, how long they stayed asleep, and restlessness during the night. They also measured heart rate variability, or HRV, the variation in time between heartbeats. A higher HRV generally indicates better cardiovascular health and resilience. And they performed cardiopulmonary exercise tests to assess how well the participants' hearts, lungs, and muscles work together during physical activity. This study was inspired by earlier research suggesting that exercise can help improve sleep. However, many earlier studies relied only on subjective questionnaires and didn't measure things like heart health or the body's stress response through HRV. These researchers asked the question, could exercise improve both sleep quality and heart rate variability? variability in older adults who are struggling to get enough rest. And here's what they discovered. After 12 weeks, the group that exercised experienced significant improvements in their sleep. On the Pittsburgh Sleep Quality Index, 55% of the exercise group achieved what's considered a good sleep score by the end of the study. In contrast, no one in the control group reached that level of sleep improvement. In terms of how much sleep they were getting, the exercise group self-reported gaining about 90 extra minutes of sleep each night. They also fell asleep about 18 minutes faster. Meanwhile, the control group only reported about 25 extra minutes of sleep, with no significant change in how quickly they fell asleep. When looking at the data from the wearable sleep trackers, the improvements were still there, though not as dramatic as the self-reports. The wearables showed that the exercise group fell asleep faster, from about 25 minutes down to around 16 minutes, and slept about 20 extra minutes per night on average. In contrast, the control group did not gain significant extra sleep time according to the wearables. In fact, they even lost 7 minutes. It's fascinating to see that the numbers from the wearables and the self-reported questionnaires were so different, yet both pointed in the same direction. Exercise seems to help people sleep better. Why the difference between the two measures? Well, self-reports reflect how people feel about their sleep, which matters because sleep is deeply tied to our perception of restfulness and our memory of how long it took us to fall asleep. Meanwhile, wearables record physical movement and estimate sleep, but they're not perfect either. For example, lying awake in bed but perfectly still might look like sleep to a tracker but feel very different to the person. One of the most fascinating parts of the study was how sleep quality and heart health were connected. The researchers found that as the exercise group's sleep quality improved, so did their heart rate variability. A higher HRV reflects the body's ability to switch efficiently between the sympathetic nervous system, our fight or flight response, and the parasympathetic nervous system, our rest and digest state. This balance allows for better recovery and overall well-being. In simpler terms, it means your body is handling stress more calmly. Of course, no study is perfect. This one involved just 40 participants, consisting primarily of postmenopausal women. A larger study would have been better, but that's not always possible. And while the results are promising, everyone's body and sleep patterns are unique. This research doesn't mean that exercise will instantly cure insomnia for everyone, but it does suggest that moderate, consistent exercise can be a tool for improving both sleep and heart health. So what can we take away from this study? Keeping in mind that my goal is to simply summarize this research so that you can make more informed decisions and that I'm not giving medical advice. Simply put, regular, moderate exercise, even just 3 times a week, may help middle-aged and older adults sleep better, fall asleep faster, and support a healthier heart. It's a gentle, hopeful message reminding us that small changes can ripple into big improvements in how we feel. If you're struggling with sleep, please consider talking to a healthcare professional. If you'd like to explore this research more deeply, I've linked the study in the description below. I hope you're feeling a little calmer and perhaps inspired to move your body a bit more this week. Thank you for spending your time with me here today on Research Reflections. I'd love to hear your thoughts, questions, or experiences related to what we discussed, so feel free to share in the comments below. If you noticed anything I might have gotten wrong, or if there's new research I should know about, please let me know. I'll make sure to pin any corrections or updates in the comments so everyone has the most accurate information. If there's a particular paper or topic you'd like me to explore further in a future video, I'd love to hear your suggestions. If you'd like to keep exploring interesting research in a peaceful, relaxing way, consider subscribing and joining me for future episodes. Until next time, take care.